Hi there, welcome to Sheer Recovery. Today we're going to take a close, in-depth look at one of our multiple residential treatment centers here in Southern California. Sheer Recovery is focused on substance abuse and mental health issues, things like alcohol withdrawal, benzodiazepine use, opiate abuse, as well as mental health like anxiety, depression, and these types of disorders that occur at the same time. We call them co-occurring disorders, and that's what we treat here at Sheer. The first step in determining if Sheer Recovery is right for you or your family is to visit our website. It's sheerrecovery.com. There you can fill out a form with some basic information and have somebody call you back. You can chat with us on our chat box. There's a live agent there, it's not AI, and we'll give you real answers to your questions. Most importantly, you can call. Our agents are here 24 hours a day, 7 days a week, holidays included. It's never a wrong time to ask about your recovery. From there, our admissions coordinator is going to help you understand your health plan coverage. Do you have a deductible? Is there an out-of-pocket expense? Unfortunately, we're not a government or state-funded agency, so Medicare, Medicaid, and these types of disability insurances aren't going to cover your treatment here, but they will cover your medications and any medical that comes up as a part of treatment. So let us know if you have those types of coverages. Once you and the agents talk, complete an assessment, and determine that Sheer Recovery is the right place for you or your family member to get sober, we want to start the process. The first thing is getting here. Your admissions coordinator is going to help you arrange transportation, whether that's airfare, train, or bus. Once you're within 100 miles of our center, we're going to send a driver to pick you up. Our driver is going to provide safe transportation to one of our Southern California locations where you'll begin the intake process. Remember to sign disclosures. We cannot confirm or deny if you're in treatment without your approval. So anyone you want to be able to call and check in on you, or you'd like to be able to call out and check in with them, put them on a release. Upon intake, you're going to turn in your property. Now remember, detox is a blackout period. You're going to see a doctor who's going to prescribe medications, so you won't be using your phone for the first 5, 7, or 10 days until you're medically cleared. During the intake process, you're going to take a few different tests. One is your history and telling them about drug use and your behaviors and other issues so that we're familiar with you and we know how to help best. You're going to take a genetic test. That genetic test is going to tell us which medications work well for you and which ones don't. This way you get better faster. You also take a drug test. This way the doctor knows what's in your body, even to the nano level. Now he's going to prescribe medications. We are a non-medical facility, however, we have subacute detox. So we have on-site nurses and we have doctors who are going to prescribe medications so you're not sick, you're not in withdrawal, you don't have anxiety, you're able to sleep, you're able to get your appetite back, all of these things. During treatment, you're going to meet one-on-one with a therapist. That therapist will let us know of any mental health issues. They'll help you with specialties like EMDR and different therapeutic approaches to help you recover. You're also going to have one-on-one sessions with a case manager. Your case manager will help you file for medical leave, so your job and your insurance are protected while you're in treatment. You can apply for short-term disability, so you can get a paycheck while you're in treatment. We can help you resolve issues with Child Protective Services or legal issues that come up like DUI or possession. These are all things we're here to help you fix. Make sure you communicate with your case manager, especially when it comes to protecting your job. Remember, cannot lose your job for going to rehab so long as you complete the proper documentation. We've got a lot of ancillary services here. Now these are elective. You don't have to choose them, but they're there if you'd like to. First, our chiropractor. He can do some adjustments in case you have pain issues. Sometimes pain issues lead to opiate use or other drug abuse. We also offer Synaptic electronic activation, SEA. Very simply, this is to balance your neurotransmitters in your body like GABA, dopamine, serotonin. The way I like to put it is it helps you feel better faster. We've also got on-site physical therapy. This way, if you have other joint and muscle issues, stretching techniques and joint manipulation helps, and we offer those services. On-site yoga. Off-site activities. On the weekends, we'll go to the beach. We'll take the boat out in the harbor. Maybe we'll go to Disneyland. You want to have a good time, and that's part of it as well. But what's important, whether you're completing a 30-day or 60-day or a 90-day program, is that every client when they leave here is going to have a discharge summary. This is something you can share with your sponsor, your friends and family back home to not only have a roadmap for yourself of what to do when I leave treatment, but also how your family and loved ones can help keep you accountable. We'll make sure there's an outpatient program that accepts your insurance or is affordable in your area, so you can go and see a therapist a couple of days a week. We'll make sure you have local meeting access, so you know where AA and NA meetings are in your hometown, whether it's here in California or back at home. We want to make sure you have a plan of success, so that you're not just successful here, but you're successful back home. Listen, you know that some of these things will benefit you and your family. It's ringing true. So don't delay, call today and start your recovery program now.